My name is Pete, and like you, I was trained to practice mind-body medicine, which means that we understand the interconnected parts within a person. One of my favorite benefits of this approach is that we believe OMT is a useful tool in the treatment of even psychiatric pathologies. The Foundations textbook, the sort of classic volume that we all trained on, in its chapter about OMT as it pertains to behavioral health, and in this section specifically depression, says osteopathically trained physicians routinely work with their patients' cognitive stress coping styles in addition to pharmacologically managing their depressive symptomology. Now, I like this quote because it seems to encapsulate something many of us have experienced in our clinical practice of osteopathic medicine, which is that alongside appropriate pharmacotherapy, we actually have the chance to add to or sort of expand on our patients' coping skills, which is the bedrock for successful treatment to any psychiatric pathology, which led myself and a number of my fellow students to wonder, what evidence is there to describe or substantiate this experience that we've all had? So we decided to conduct a meta-analysis to answer the question, has the impact of OMT on treatment of depression been measured? And we were able to include 3 very small studies in our answer to this question, totaling a sample size of 45. Here we see that each of these 3 studies actually measured depression using a different metric. So each of these 3, the Zone Depression Scale, the HANS questionnaire, and the HADS questionnaire, are all subjective, self-reported, symptom-based tools that allow the patient to essentially rate the severity of their symptoms, both before and after treatment. So we wanted to know, were the patients who received OMT more likely to report improvement in the severity of their depression symptoms than those who did not? And we see that in the control group that did not receive OMT, very few of them actually reported improvement in the severity of their depression symptoms. Meanwhile, the group that was treated with OMT, it was about 50-50. They were just as likely to report improvement as they were to not report improvement. Because the population categories and the outcome variable were both qualitative in this study, we used a chi-squared test, and we actually did find a statistically significant difference between these 2 groups. And that leads us to say with confidence that OMT does improve outcomes in depression when used as an adjunct to pharmacotherapy. To me, the most important takeaway from this meta-analysis is that we are in desperate need of more data. We would love to be able to answer more specific questions pertaining to exactly how OMT benefits patients who are experiencing major depressive disorder, but we just can't say anything with certainty based on this, specifically because there have been so few studies on this so far that we had to make really general statements just to be able to include more than one in this meta-analysis. So if we're going to be able to parse out any more detail about exactly how and when and why and for whom OMT is beneficial, we simply just need more data. I think it's important to note as well that quality data in this discussion is going to involve a control group that was given a sham protocol. This controls for factors outside of the actual manipulation itself, such as the fact that the patient receiving OMT is getting a little bit of extra attention from their physician, as well as just the comfort of physical touch. Once you eliminate those variables, you're really looking at the mind-body connection of OMT. You're aligning anatomical structures, and you're actually seeing improved cognition, improved emotional health, and improved spirituality in patients with depression. So it is important to continue studying this and to obtain high-quality data, essentially. However, this was encouraging because OMT was found to be useful. And so that's absolutely a key takeaway as well. Finally, it's key to note that OMT was an adjunctive therapy in all of the studies included in this meta-analysis. So I think that speaks to the other side of the mind-body duality in that, we don't simply treat psychiatric pathologies by treating the body. We also use talk therapy addressing the mind directly, and we also encourage healthy neurochemistry with pharmacotherapy. So I think studying OMT as an adjunctive therapy lends credibility to the mind-body dynamic that we profess in osteopathic medicine.